These are the questions you guys asked me in Q&A, and honestly, I didn't prepare for anything, but because some answers don't need preparation, they need honesty. So let's just talk. What if 1 month of starting MBBS class is wasted? Honestly, nothing big happens. You just lose a month figuring out who your new friends are. People form their groups. You feel a little left out, and that's okay, because by the time you enter those groups, you will know who's real and who is temporary. So don't worry about missing out. Sometimes being late helps you see people clearly. Sir, how to adapt discipline? Okay, so discipline isn't something you adopt like a pet. It's something life teaches you, sometimes gently, sometimes by throwing bricks at your head. It comes with time, experience, mistakes. Either you choose to get disciplined or life will force it on you. And if you still don't learn, you'll just keep floating in midair. And trust me, floating does get tiring after a while. Um, Third NEET PG attempt. Parents want me to get a private seat. What should I do? So, if your finances are okay and your parents are ready, go for it. Because you have already given 3 attempts, and that's not failure, that's effort. But sometimes you have to know where to stop. If you have got time, try again. If not, take the seat. There's no point staying in a battlefield that's already drained you. You can still prove your dedication after PG, work somewhere, grow, give back. It's like learning to drive. You can study about driving for 10 years, but at some point, you have to buy the car and drive. How should a first year learn anatomy or start PG preparation? You are in first year, so stay there. Focus on what's in front of you, not what's 4 years away. If you learn your basics well now, this is your PG preparation. And for anatomy, before reading books, look at things. Dissection halls, models, see them. Books are just for remembering the names. Understanding starts with seeing, with observing. How to face tough times in life? Whom should I talk to? Talk to yourself first. And yes, listen to others too. Sometimes they say what you were already thinking. But at the end of the day, you will still come back to yourself. You ask, you listen, you decide. Because even if 10 people advise you, you will only follow the one voice that feels like yours. So listen to yourself. If not, listen to others and then decide whom to listen to. I'm in third year MBBS, no seniors, scared for the final year. Seniors aren't just people, Seniors are not just people who are 1 year above you. They can be professors, mentors, or even online friends. You are actually lucky. You are learning from people with real experiences, not from people who just survived a year more than you. That means you will grow without a bias. So you already have seniors around you. How do you uplift your mood when you feel depressed? I don't. I take a pillow, I cry. Days, months, sometimes more, until my soul says it's fine. I don't drink, of course, for coffee, but I don't drink, I don't smoke. I sit with it. Sometimes I talk to my best friends, and with time, it fades. You don't heal by forcing yourself to feel better. You heal when your pain gets tired of staying in your head. PG life is so frustrating. I never found it frustrating. Maybe because I loved my branch and had good friends. Frustration usually comes when you are stuck with people who don't get you or a subject you don't love. PG life is tough, yes, but it's not torture. It's transformation. You just have to find good people around you. Orthopedic earnings after residency. Everyone wants to know this one. So if you're a senior resident, you get around 80,000 to 1 lakh. An assistant professor gets around 1.5 lakhs. Your own setup may be 5 to 6 lakhs per month, depending upon how much you build. In fellowship, sometimes you don't even get paid. You pay your mentor. So yeah, it's different everywhere. Sometimes you get like 30,000 or 40,000 per month as a fellow. Basically, your earning depends on your learning. The more you invest in skills, the more you earn later. Your most unique surgery. Operating on my own mother. Because every incision made me realize how personal this profession is. When you operate on someone you love, it stops being a surgery and it becomes a prayer. Which branch is better, MS Orthopaedics or MD Pediatrics? Since everything is saturated. Okay. If you're choosing based on saturation, just forget it. Because every branch is saturated. Do what you actually love. Because when you love what you do, you stop checking how the crowd road is or how crowded the road is. You just focus on your lane, because saturation is a myth, but passion is not. That's it. These were just answers. These weren't just answers. These were experiences. If even one of them made sense to you, hold on to it, because half of medicine is science and the other half is surviving it with it. See you in the next one.